Hi guys, how are you doing? Hoping you're doing fine. I'm well, I'm okay, I thank God. So today I have another video for you. Today I want to talk to you guys about pelvic inflammatory disease. This is something that is affecting so many women outside there, that is causing a lot of pain, a lot of infertilities around. So today I want to talk to you guys about it so that you can just be aware and you can know the signs and symptoms. And I hope this helps someone out there. Okay, so guys, stay tuned. If you haven't subscribed, please do so. Consider subscribing. Give me a thumbs up because it really helps, supports my channel. So let's get into the video. So guys, what is pelvic inflammatory disease? So this is, in simple terms, inflammation of the genital tract, and it spreads to the endometrium and to the fallopian tubes and the ovaries. So this is mainly caused by bacterial infection. There is a bacterial infection called chlamydia, and there's gonorrhea. These are types of STDs that can cause PID, pelvic inflammatory disease. So these infections affect the genital tract, the fallopian tube, the ovaries, and the endometrium. The endometrium is basically the inner part of the uterus. Okay, so there's also another bacteria called E. coli. E. coli also causes PID, and it also causes urinary tract infection, which is commonly known as UTI. Okay, so these are the main bacterias that cause pelvic inflammatory disease. And as I mentioned, pelvic inflammatory disease is the inflammation of the genital tracts and of the endometrium, of the fallopian tubes and the ovaries. Okay, and it can spread to the pelvic peritoneum. This is basically around the pelvic region. One of the risk factors is if you are a lady, a woman in your reproductive age below 30 years, you are at risk of getting PID. Okay, and then if you have STDs like gonorrhea and chlamydia, as I mentioned earlier, because those are the causes of PID, you are at risk of getting PID. And also, if you've inserted in your early period, after insertion of IUCD, you can get PID, because it is caused by any infection that can go into your uterus. Okay, so that procedure, copper T. For those who don't know what IUCD is, it is the coil method of family planning. So that procedure can cause, infection down there, and you can get PID. And also another risk factor is any gynecological procedures, like as I mentioned, IUCD, it's a gynecological procedure. Or maybe if you want to check maybe okay, I don't know if it's called VE, no, but any procedure that involves anything getting into your reproductive area or through your vagina, that can cause an infection down there, and it can lead to PID. Okay, so those are things that you need to watch out for. I'd like to inform you that some people do not really experience any symptoms, some people with PID. So most of them don't, actually. Most of them are asymptomatic. and some of them do experience the symptoms, and I would like to inform you about the symptoms. So there is lower abdominal pain. Some people experience that, and it is on the lower quadrant of the abdomen, and it is mostly on the right quadrant, right lower quadrant of the abdomen. That's where you experience that a lot of pain. Okay, my second signs and symptoms you can experience is pelvic pain. By pelvic pain, you can just have that pain on the lower part of the stomach, of the abdomen, but the middle part. So that's when you know that you have pelvic pain, and it is normally very tender on touch. When you go to the doctor and the doctor examines you and tries to palpate, it is very, very painful. Another signs and symptoms that you're supposed to watch out for is fever. Most of patients with PID normally have very high fever of, they go up to 38 or even 39. So this is a risk factor that you have to watch out for. Some patients do have vaginal discharge, and this vaginal discharge can be mucoid, mostly mucoid, and purulent. By purulent, I mean it has pus, and sometimes it has a very, very bad smell, so you have to watch out for that. Okay, another sign of symptoms that is normally not so common is nausea and vomiting. And another sign you need to watch out for is abnormal bleeding. Okay, by abnormal bleeding, I mean you can have spotting, you can have like bleeding in between your periods that is not normal. As a woman, you understand yourself and you know your body and how maybe your periods normally are. So if you notice that maybe at some point you start having spotting and maybe bleeding in between your periods, and maybe if you're on your menopause and you still experience some bleeding, that is alarming and you need to go see the doctor. Okay, so abnormal bleeding, that is a sign that maybe you have PID. Then another sign is dysuria. Dysuria is basically pain when urinating or when passing urine. So this is a sign, but it's also common in UTI. So could be maybe you have UTI or maybe you have PID. There's also a sign called dyspareunia. This is pain during sexual intercourse. This is a very serious one, so you need to watch out for it. Okay, the last symptoms I have is maybe palpable mass. You can feel, maybe when you touch your lower abdomen, you can feel as if there is a mass inside your abdomen. So this is a sign and symptom. These are the signs and symptoms you need to watch out for. So now that you already know the risk factors and you already know the signs and symptoms, I would like to inform you how the PID can be treated. Okay, as you all know, PID, or if you didn't know, PID is very serious and it can cause a lot of pain, and it can also cause infertility. So if you have infertility, and maybe you have any of these symptoms I've mentioned, please go and see the gynecologist. Okay, it could be that maybe ni PID that is disturbing you. Okay, so if you go and see the doctor, you'll be put on treatment, and maybe the treatment, since it's bacterial infection, the treatment that is the best treatment for it is antibiotics. You can be put in a combination of antibiotics to kill those bacteria, and this really helps. Okay, this is one of the treatment. The next thing you need to know, if you are a woman and you have a partner or partners, you know, it is very important to have your partner checked. You know, you go with your partner to the doctor so that he can be also checked and treated. Cause you can go and get the, you know, what am I saying? You can go and get the treatment, but then you come back and get involved with your partner, and then he infects you again. So there's nothing utakuwa umefanya hapo. So please just make sure you go get your partner to be checked and also treated. This is very important, and you have to know that your partner does not have to have the symptoms. You know, it could be he's infected but he does not have the symptoms, so don't risk. Go with your partner, go with them so that they can be checked, and you know, they can rule out if your patient, you know, your partner is okay. And if your partner is not okay, you know, you have to get treatment, definitely, so that all of you can be in a good state, you know, to continue with your life. And another thing, you also have to temporarily abstain during the treatment. This is very, very important. You have to abstain until you complete the treatment and until the symptoms are over. All right? This is very important. Guys, I hope this video has helped someone out there. I hope you've been educated. I hope you've learned maybe one or two things. So PID is very serious. It's a very serious disease. And if not, you know, treated, it can cause a lot of harm. I've had patients with infertility, and they've been, you know, they've had infertility for so long, for like 10 years. Kumbe it was just PID. This was something that could have been treated, you know, long time ago, and you know, wangekuwa na watoi. But it is good to be aware of these things and, you know, go get checked as fast as possible. So guys, thank you very much for watching my video. I hope you've been educated. Thank you very much for watching the video till the end. Please give me a thumbs up if the video really helped you in one way or another. If you are a new subscriber, please subscribe. Please consider subscribing. Okay? So guys, see you on my next video.